Often I'm asked by patients in regards to their knee arthritis. We've failed conservative measures and we're discussing joint replacement. A question often asked of me is, am I a candidate for a partial or a total knee replacement? I think there's two ways to think of that. Traditionally, a partial knee replacement was less surgery and quicker recovery. In today's world, a total knee replacement can be equal to that. Outpatient performance and quick recovery. What it really comes down to is the type of disease you have. If it is isolated to one part of the knee and your symptoms are isolated to one part of the knee, and that decision between you and your surgeon is that you are a candidate to proceed and you understand the risks and the benefits, then partial knee replacement might be right for you. But ultimately, it's the decision between you and your surgeon to see if you're a candidate for it.